Okay, this video is nephrology a joke like cardiology? I've been reading a lot about the kidney lately because I'm seeing parallels to the brain. It's interesting to me. And I'm starting to see parallels to other fields. Let me know if you see a pattern here. So first of all, you look at the cardiology books and you read about the low-fat vegan diet with no oil by Caldwell-Esselstyn, and it's the only diet really proven to reverse coronary artery disease. And it's in none of the cardiology textbooks, including the recent edition of the Harvard and other Ivy League cardiology, pathophysiology textbooks and articles. You never see any mention of Walter Kempner or Caldwell-Esselstyn or Dean Ornish. Esselstyn's 2014 article published in Family Practice Journal was published in a Family Practice Journal, not in a cardiology journal, okay? There's not much money in a low-fat vegan diet with no oil. Famous cardiologists, even after Esselstyn's work and Ornish's work, were going around saying, oh, you can't really reverse coronary artery disease. Other ones recommended the Mediterranean diet and olive oil, all this nonsense. Okay, cardiologists, they mostly treat hypertension and high cholesterol with medications, okay? And these tend to fail, and then the patient develops, chest pain related to coronary artery disease, angina, myocardial infarction, that's a heart attack, atrial fibrillation, congestive heart failure. So anyways, there's big money from placing stents, about $30,000 each. Coronary artery bypass graft, a cabbage, $150,000 total bill. Ablations for atrial fibrillation, pacemakers for arrhythmias of different types. So there's big money, but there's no money in the vegan diet. I'm sure that has nothing to do with the reason why they don't promote it. Nephrology literature seldom goes into detail on very low protein diets. There has been a significant amount of work done on it, but it's usually they sort of half-ass the study and don't really go very low protein diet. They'll go something like 0.6 grams per kilogram per day. That's called a low protein diet rather than a very low protein diet, which might need, I'm not going to get into all the details of it, essential amino acid supplements or a keto analog, which are amino acids with the nitrogen removed from them, okay? But what I'm basically saying is it's really understated, it's underpromoted, it's not as big, anywhere near as big as it should be. I don't see a lot of push in the nephrology community for low-fat vegan diets, very low-protein vegan diets. Okay, I read a 2004 book by Mackenzie Walzer, a famous nephrologist from Johns Hopkins, and he was sort of like the leader in nutritional components of nephrology care, and he really didn't know too much. Okay, then there's a more famous guy, or more contemporary guy, Dr. Kalantar Zadeh out of UCLA, and he knows more, and he does recommend to include nutrition therapy as part of your treatment of kidney failure patients before dialysis, but he doesn't push it that much. And in my impression of hearing him speak, he kind of half-asses things, just saying, oh yes, we want to lower protein and it's part of our therapy, rather than say you must go low-fat vegan with no oil and very low in protein, and this is how you lower phosphate. It's really kind of wimpified compared to what I would expect. I really didn't have much of a sense of renal nutrition until I started seeing the lectures by this dietitian, Jennifer Moore. She's quite good. She's got a bunch of YouTube lectures. And then this renal patient, Lee Hull, he's the guy who wrote the book Stopping Kidney Disease because he had to figure out how to save himself. He's a bright guy. He's not from a medical or health background. And there's lots of things that a kidney failure patient can do to help themselves. I had separate lectures where I talked about this. I think my lecture on how to protect your kidneys at Be Green with Amy, whereas I went into the most detail. But it's kind of obvious, okay? I mean, super fast. Animal protein is acidic. That's bad for the kidney. Plant protein is alkaline, especially fruits and vegetables. That's good for the kidney. Until you're in the last stages of kidney failure, the potassium actually is beneficial until the final stages because it's a vasodilator. Same thing with magnesium, a vasodilator. Same thing with plant nitrates, a vasodilator. You also get the benefit from the fiber, which maintains the gut walls. You don't get leaky gut, you don't get postprandial endotoxemia, you don't get blood-brain barrier leakage, and you get better protection of the endothelial cells and the glomerulus of the kidney. So that's all good, and you avoid all the problems with meat. The sat-fat increases proteinuria from the kidney. That's bad. It increases atherosclerosis. It increases hypertension. It increases diabetes. The meat's all bad. The meat phosphates are more bioavailable, absorbed, so they're worse for the kidneys. A meat-based diet promotes leaky gut. A meat-based diet promotes gut toxins, things like indoxyl sulfate, things like indole acetic acid, and also p-cresyl sulfate. So all this, and TMAO, trimethylamine oxide, all of these bad things come from eating a largely meat-based diet. They're all bad for the kidney. So it's obvious. You don't ever want to eat meat, okay? And you don't want to eat any processed foods either. All the good stuff is in the plants. That's just the way humans are designed. But you don't hear them. And I'm sure it's got nothing to do with the fact that nephrologists make hardly any money from nutritional therapy, but they make a lot of money from dialysis. But dialysis is not a great deal for the patient. Over half of them are dead within 5 years. It's like having a cancer. So, I sort of see a pattern that because there's no money in it, or very little money in this low-fat, low-sodium vegan diet with no oil and low protein, hardly anybody's pushing it. Okay, and it's the answer. Internal medicine doctors don't push it when it's the best treatment for obesity, hypertension, or diabetes. Cardiologists don't teach it. It's the best treatment for coronary artery disease. Vascular surgeons don't teach it. It's the best treatment for peripheral arterial disease, what they deal with, like in the legs and the pelvis. Oncologists don't teach how to prevent breast cancer. That would also include avoiding estrogenics. They say, raise money for the pink ribbon to give it to the chemo company, but they don't talk about how do you help this patient, teaching them to avoid estrogenics, the problems with deodorants and the problems with personal care products, with water filtration, all these easy things they can learn to dramatically lower their risk of breast cancer. So anyways, I think the point is clear that there has to be something else if healthcare is ever going to improve. Because right now, all the money comes from keeping the doctor ignorant and the patient ignorant. And there's really no incentive to try to cure the patient. You cure the patient, you lose a customer. If you just let them keep on going down the tubes, you make big money off these patients from dialysis, from stents, from cabbage, from cancer chemotherapy, from vascular surgery, from keeping them, on hypertensive pills and other pills, cholesterol pills every day, milking them like a cow. So anyways, the only way this is going to change, there's only two things that are going to change. One, patients get educated and they learn how to take care of themselves because they're the ones who have all the power to make themselves better. And number two would be that you have this major, religious reform in this country. Healthcare reform can only come from religious reform. Anything else is going to be a joke and it's just going to be nonsense. It's going to be a way to sell more drugs. So anyways, I thought that was a little interesting. Hope you enjoyed it.